Hi, and welcome to Protocol Training for Program Managers. My name is Jessa Lane, the Medical Quality Assurance Director for Wall Residences, and I'm going to guide you through this training module. The purpose of this module is to have a better understanding of protocols and who needs protocols, as well as our format and our template for developing those protocols that we can include them in the person-centered plan. Protocol definition. A protocol is written instructions for providers to follow if an individual has a specific or frequent health concern. Examples of individuals that would require a protocol for a medical issue are individuals who have a history of choking, aspiration pneumonia, have diabetes, have frequent seizures, fall often, and these falls could be related to medical conditions such as someone with Parkinson's disease. They get the rigid kind of shuffly gait, might make them more prone to falling, or individuals who fall because of behavior. There's also people who suffer from frequent constipation. They may need a protocol. The difference between a protocol and a procedure. A procedure outlines step-by-step instructions for performing a specific task. Procedures are very task-oriented. So for example, if I were to teach someone how to change an individual's colostomy bag, I would give them step 1, do this, step 2, do this, step 3, do that, okay? A protocol, however, gives a more global perspective of an issue that someone's having. So it's more problem-oriented than task-oriented. So it outlines a specific situation and the interventions that are provided based on that situation. So in front of you, you'll see there's 2 examples of emptying the trash. One example gives you step-by-step instructions, and the other example gives you an overall view of when the trash gets emptied. So can you tell me which one is the protocol and which one is the procedure? If you guess the one on the right as the protocol, that would be correct. Writing a protocol. Because protocols can be complicated, we wanted to create a process where writing protocols made sense. And so we broke it down into a 5-step process for protocol writing. And we're going to talk about all of those steps right now. Step 1, in order to write a protocol, you have to identify the problem. You can't write about a protocol if you don't know what you're going to be writing about. So some examples, again, of potential health risks that an issue may suffer from, or a potential health issue would include diabetes, choking, fall, seizures, constipation, and there can be numerous others. So just because we've used these as examples, that does not limit the fact that these are the only protocols that we could have in services. For example, if someone has uses a wheelchair all the time for ambulation, they may need a maintaining skin integrity protocol because we don't want those people to come down with pressure sores. So just an example. Step 2 is to describe the problem. So what does this health problem or health risk look like? So if someone has a seizure disorder, within the protocol, we want to give a good description of what someone's seizure activity normally looks like and how long those seizures last. So there are multiple different types of seizures that will manifest in different ways. Some people may have grand mal seizures where they have severe muscle contractions and convulsions, and other people may have what we call absent seizures, where they just kind of stare off into space for a few seconds. It's important within the protocol that we know what is normal for this person, what is baseline for this person. And when we're talking about seizures, it's also important to know how long those seizures last. So if a seizure typically lasts between 30 to 60 seconds, we want to have that outlined in the protocol. As far as an individual who's at risk for aspiration and choking, what is it that's occurring at mealtime that makes us think this person is at risk for aspirating and choking? Does this person have a tendency to eat fast? Do they shovel food into their mouth? Do they not chew their food properly? Do they gulp liquids? Those are the kind of things that we're looking for as far as what needs to go in the description or the describing of the problem. Step 3. This is kind of the meat of the protocol. This is where we describe the supports that are provided. So this is the part of the protocol where we really want to make sure that we've collaborated with our provider. Because we want to make sure that we are accurately capturing the things that they're doing and putting them in the protocol to keep this person safe. We want to give credit where credit is due, and we want to know that the protocol that we've developed is actually going to be meaningful and reflective of the services that are being provided. So one of the things that you can do, just as a recommendation, is when you go in to develop a protocol, tell your provider that between now and the next supervision, when this specific health risk or medical concern comes up, to write down the things that they did, because then we can include that as part of the supports that we've provided. And that really helps build relationship and trust and opens the provider up to be able to really receive credit for the excellent work that they're doing. So an example would be if someone has a seizure disorder and we were going to describe the supports provided for this, maybe an individual has an order for a helmet. We would give people medicines to help with their seizure disorder. We'll provide comforting techniques, all of those sorts of things that we're doing to keep this person healthy and safe during their seizure. If it's someone with a choking and aspiration risk protocol, are we giving verbal cues to remind someone to swallow and chew? Are we giving them a modified diet where we've chopped the food? Are we thickening the liquids? These are the things that we are doing to keep this person healthy and safe based on that health risk that they have or that medical condition that they have. The fourth part of the protocol is when to seek medical assistance. We want to make sure that we include anytime there's a medical emergency that we're going to contact 911 or another healthcare professional. Okay, so some examples that you could include in there. If someone's actively choking, we're obviously going to call 911 and perform basic first aid and CPR. We're going to contact a physician if someone's seizure looks different than what's normal seizure activity for them. We may contact the doctor if someone who has chronic constipation hasn't had a bowel movement in 3 days, or we may put that in the protocol under the supports provided section. We may, if someone has diabetes, we may make sure that the doctor is notified if someone's blood sugar is chronically low first thing in the morning. It's when are we going to seek medical attention on an emergency basis, and when are we going to seek medical attention in kind of a more non-emergent routine basis. The fifth step of the protocol writing process is not actually a part of the template or the format. The fifth step is the evaluation step. This is an ongoing process because we want to make sure that protocols are meaningful, and so we have to always evaluate whether or not the things that we're doing are actually working so that we can make changes. Typically, protocols only need to be updated annually unless there's been some sort of change in an individual's health status or condition. We'll get those protocols updated. So what we're going to talk about now are a few sample protocols. So in the slide that follows, I'm going to pull up what our template is and what our format is, and we're going to walk through some sample protocols for you guys. Okay, so on the screen in front of you, you'll see a sample protocol, and this is our standard template. So this is what protocols will look like when they are printed off for the provider to keep in their reference notebook. And I didn't mention this before, and I should have. Providers will need to keep all hard copies of protocols in the service in that reference notebook so that new staff that come on can read them and become familiar with them. They can be a point of reference when there's questions or concerns. But this is also the way that they're going to look when they are attached to the PCP in our online LoRa system. Okay, so you'll see the first part is to identify the problem. Apparently, Sally Sunshine was diagnosed in 1979 with grand mal seizures. So that's our problem. She has grand mal seizures. Then we need to describe what those seizures look like. And according to this, Sally will typically lose consciousness, have severe muscle contractions and convulsions. Her seizures can last between 30 seconds to 2 minutes. She typically has a seizure once per month, and normally there are no pre-seizure signs or symptoms that Sally will communicate with us to let us know she's about to have a seizure. Although sometimes Sally will yell at the onset of a seizure. So now we understand that Sally has seizures and what Sally's seizures typically look like. So the next section is then the supports provided. So what are the things that we do to help Sally maintain her health and safety because of this severe seizure disorder? So one of the things that we are going to do is we're going to make sure that if she's standing when she starts to have a seizure, that we safely support her to the floor. We're going to roll her on her side so she doesn't choke or aspirate on her saliva. We're going to make sure there's no restrictive clothing around her neck. We're going to make sure that we've gently loosened to prevent difficulty breathing with any clothing that's tied around her neck. We're going to make sure we never put anything in Sally's mouth. We're not going to physically restrain her limbs because we don't want her to have fractures or breaks. We're going to stay with Sally throughout the course of her seizure and provide emotional support for her to let her know that she's not alone. We're going to record all of Sally's seizures in the seizure log, and just so you know, the seizure log is located in the LoRa system, and this needs to be used by providers to document every seizure that an individual has. If you have more questions about how to navigate the LoRa system, just talk to your coordinator about that. And then we're also going to give Sally her prescribed medications to help control her seizure disorder. And then you'll see the last section is medical assistance. So when do we seek medical assistance? According to this protocol, Sally sees a neurologist and a PCP on a regular basis. If she has a seizure that lasts more than 5 minutes, we're going to call 911. And also we're going to contact her neurologist if we ever have any questions or concerns about her seizure disorder. You'll see there's a spot for the signature of the physician and a signature of the provider and the date. So we want to make sure that we're getting a physician signature on most protocols because we want to be able to share that responsibility with the physician, because we are not licensed healthcare professionals and can't make those decisions. But if we get a doctor to sign off on that, we've shared in that responsibility and ultimately that liability, and we've increased our chances of making sure that the interventions that we're providing are safe and they are physician directed. The next sample protocol that you'll see is Sally Sunshine's fall protocol. Apparently, Sally was diagnosed with Parkinson's disease in 2006. And because of that, she has a unsteady gait, and she's prone to tripping and losing her balance and falling. So there are some things that we're going to do to keep Sally safe. And if you look under the supports provided, you'll see a paragraph that kind of explains what it is that we're doing, some specific steps that we're going to implement in the service to keep Sally from falling, and then when we're going to follow up with her primary care physician or her neurologist about her Parkinson's disease. Again, you'll see a spot for a physician signature and the provider signature. Now, what you see in front of you on the screen now, this is our diabetes protocol. You'll see that the format of this is a little bit different than the other protocols. And the reason for that is we've created this to be more of an order set for providers. So since this is an order set for providers, specifically that physicians are going to fill out, we're going to use this and we're going to have this updated annually. But what information that's included on here is how often we're supposed to check someone's blood sugar, what kind of dietary restrictions does this individual need to have, what is hypoglycemia, and if you don't know, that's low blood sugar. So the doctor can, because that can vary depending on the severity of someone's diabetes. So the doctor can give us some more precise parameters on what to do when someone's sugar is low. And then you'll see these are the steps that we're going to take if the sugar is low and someone's awake and alert, or if the sugar is low and they are unconscious and unresponsive. Then we move into hyperglycemia, which is high blood sugar. So what is hyperglycemia for this specific person? What specific orders or things do we need to do to manage that hyperglycemia? And then you'll see where there's a list for insulin names, frequency, and other oral medications. And then there's a spot for additional recommendations. And we're going to have the physician sign and date this as well. So the diabetic protocol is different. The last one that we're going to talk about is the blood pressure protocol. We also have a blood pressure and a heart rate protocol. It really just depends on what this person needs. So this blood pressure protocol is for individuals who have high blood pressure or perhaps low blood pressure that we are treating with medications, and we are going to be taking their blood pressure on a fairly consistent basis. So what we want to get from this protocol is what is normal blood pressure for this person, what would be high, what would be low, okay? And then what are we supposed to do about that, okay? On top of how many times a day or a week should I be taking this person's blood pressure. We're going to have the physician sign it and the provider sign it, and that's going to be our blood pressure protocol. Okay, so now that we've reviewed some sample protocols, let me show you where you may find additional protocols to kind of help you when you're writing and developing them. They're located on the F drive. So if you click on the F drive, you double click on company, you're going to scroll all the way down until you see the medical QA folder. And this is where I keep just a bunch of information about random medical things that you may find helpful. Double click on that. You're going to scroll down until you see the protocols folder. Double click on that, and then you'll see the protocol library. So within the protocol library, you're going to see a couple of different folders. Within those folders are sample protocols that I've written, sample protocols that other program managers have written for services. So it's kind of a wealth of information as to what's out there and what could go in a protocol. Additionally, you will find the blank protocol template in a Word format, so you can open that up and edit it if you need to. You'll see protocol writing instructions, and that's just basically this video with just a touch more specific information about how to write protocols. And a protocol training for program managers. It's a PowerPoint that I created just as a kind of a quick reference guide for you if you need additional support. So there are a lot of different protocols that individuals can have. And if you have questions about things that you should be putting into a protocol, please feel free to refer to the Provider Healthcare Resource Manual. Every provider has a hard copy of this. Any new provider, this is printed off and put in their new provider booklet. And it's just a really good resource guide. I would recommend for new program managers that you take some time and review that document as well. But within the Healthcare Resource Manual, there is a section about protocols that will kind of trigger your thought process as far as what supports are we providing to people, what sort of questions should I be asking, etc. Also, if you have any questions about protocols, please contact your regional coordinator or me. You'll see that my contact information is on the screen in front of you. And I just want to thank you so much for your time and attention during this training video. I really do appreciate you, and I'm so grateful that you're out there in the field helping to support individual services to make sure that people are healthy and safe and living a life that they love. So thank you so much for your time, and have a wonderful day.